So hi everyone, and welcome to the first session of Healthy Discussions. Before we get started, I just have a few housekeeping notes. The chat box and Q&A feature are both open, so please feel free to use them. You can turn on the subtitles, which are auto-generated by clicking the closed caption button on the bottom left of your screen. And finally, this session is being recorded and will be posted to the Quality of Care NL's YouTube channel. So Healthy Discussions is a new webinar series launched by Quality of Care NL, where we have quality conversations about health, healthcare, and social systems in Newfoundland and Labrador. Our goal is to engage with you on these topics with the aim of continuing public conversations during the ongoing process of health transformation in our province. Public discussion also contributes to the growth of a learning health and social system in Newfoundland and Labrador. On the screen right now, you can see a definition of a learning health and social system as defined by Health Accord NL in its task force report. This definition might seem complicated the first time you read it, but what it really boils down to is a health and social system that continuously improves the culture of best practice, evaluation, equity, openness, and collaboration. The system learns and gets better, resulting in better care and health for all. Part of the definition states that individuals and families are active participants in all elements. By engaging in sessions like this one, by being an active participant in your own health care and wellness, by talking about and acting on issues that impact us as a society, you are contributing to a learning health and social system in our province. Tonight's session is on the social determinants of health, and we are delighted to have Dr. Janice Fitzgerald, the province's Chief Medical Officer of Health, join us for this discussion. Joining Dr. Fitzgerald for a chat on the social determinants of health is our own clinical lead, Dr. Brendan Barrett. Brendan has some questions for Dr. Fitzgerald to get our conversation started, but we will be taking questions from the audience. So please type your questions in the Q&A box, which makes it a little easier for us to manage. Sometimes questions can get lost in the chat as people chime in with their own thoughts. Since tonight's discussion is being recorded, you may wish to ask your questions anonymously, which you can do by using the Q&A instead of the chat. So without further ado, Dr. Baird, I'm going to hand it over to you.
Thanks very much, Robert, and welcome everybody to this first webinar in the series tonight. We chose the topic social determinants of health because of the importance given to that in the Health Accord NL process. And as Robert said, we are hoping to help the province towards a learning health system, but to go beyond that, which is not common across the country yet, integrating the social systems so that we have a greater impact potentially on people's health. Research has been done to look at what factors can contribute to the health of a population. And clearly you'd understand many of them are personal lifestyle choices, formal health care itself. But it turns out that the social determinants of health that we're going to discuss this evening actually have the biggest impact on the health of the population. So for that reason alone, it seemed like a good topic to kick us off. And I'm very pleased tonight that Dr. Janice Fitzgerald has been able to spare the time to come and talk to us about this. So Dr. Fitzgerald, when we use the term social determinants of health, what are we actually talking about?
Yeah, that's a really good question, and I think I don't know. It's not a simple answer, but the social determinants of health are really those things that that influence our health, that are outside of those very personal, individual health behaviors and other behaviors, and then outside of our healthcare system. So when we think about what can influence our health in society, we have to think about where we live and the environments that we live in. We have to think about how we're able to navigate that environment. We have to think about how we are able to afford to live in a healthy environment. So our income is really important. Our experiences in childhood are really important and can influence our long-term health. Things like food security and our employment, whether or not we experience racism, or whether we experience other types of prejudice, I guess, that can influence our health, and whether we're able to access healthcare, social care when we need it. All of these things are, determine our health, as you said, in some cases, a whole lot more than those choices that we make. And to a very large degree, they actually influence the choices that we're able to make. And so we have to think about that, because health is not just an absence of disease. Health is our ability to be able to, respond to our environment, to be able to feel like we can reach our fullest potential, and to feel well and resilient in our environment. So our social determinants of health are really important to help us be able to achieve that. So that's why it is so important to focus on that. In many ways, our area code is really, or our postal code is more important to our health than our genetic code.
Mm-hmm. Very much, and thank you for that. I guess if they are a basket of different factors that are external to the individual and that can influence their health.
Right.
But yet some of them are probably modifiable, not necessarily by one person, but by a society.
Yeah, that's right, exactly. And that's why it's so important for us to focus on these social determinants of health, because, very often these determinants can very much influence how we're able to make decisions about our health. And it is important to really think about the inequities really that exist in our society for certain people because of the way that the determinants of health, because of how the determinants of health can influence them. So, there are some people who may experience different hardships that, if we focus on the determinants of health, then we can really reduce some of those barriers that people may face in being able to reach their fullest potential and become the healthiest that they can be. And that's why it's so important for us to really look at addressing the social determinants of health. It's really about improving equity for people and health equity for people, so that we all have the opportunity to be able to reach that fullest potential.
And I think it will take an active effort, because when we look back at some of the data collected during the Health Accord, it was clear that there's been a very large increase in spending on traditional healthcare over the last few decades, but a far smaller increase in investment in the social determinants.
Right. Yeah, and we certainly see that over and over again. And I think that's part of our work in public health. We very much people have seen public health a lot over the past few years, probably more than they have any time in the past, at least in the recent past. And we get people think about public health as being associated with communicable disease outbreaks and things like the pandemic. But the work of public health is really focusing on trying to reduce those inequities, and it's really based in social justice and looking at the social determinants of health. And we've said for a long time that these investments in the social determinants of health, small investments in social determinants of health, can actually have large outcomes down the road. Sometimes it takes a while for us to see the impacts of those investments, and that's part of the reason why the investments don't happen, I think. But I think, especially with the Health Accord now, we're seeing that being brought into the forefront of why it's so important. So I'm hoping that we're, really hopeful that we're going to see some movement in it.
Great, thanks. Now, as Robert said, we are very much interested in the perceptions and the input from the public on all of these topics. Are there any questions yet, Robert, that anyone has asked that you'd like to bring to our attention?
No, nothing in the chat room, Brendan.
Okay.
So we'll keep the discussion going.
Sure. So Dr. Fitzgerald, how do the social determinants actually contribute to our overall health as a population and as individuals?
Yeah, so if we think about what the social determinants of health are, and we think about things like income, housing, our physical environment, our childhood experiences, all of these things really do influence how we are able to navigate the world. They influence our resiliency. They can influence our attitudes and things about health in general. And, all of that can really make a difference to our health outcomes, I think, in the long run. So the whole point of looking at social determinants of health and addressing social determinants of health is really to enable people to be able to make those choices that are healthier, to create environments that are conducive really to healthy choices, and that remove barriers for people who are not able, who may be disadvantaged in some way. Everybody deserves equity and health equity, and so the social determinants of health really can influence that, and it's important for all of us to understand that by improving the social determinants of health, that we're improving things for everybody, and taking away some of those barriers that may get in the way of everybody being able to achieve their healthiest state. And if we think about it in our own lives, if you're somebody who wants to make a choice to exercise more, you want to get out and walk more, that's a great decision. But if you live in a community where there are no sidewalks, or the sidewalks aren't plowed in the winter, or there isn't adequate lighting to be able to see, if you have mobility impairments of some type, and you don't have good walkability in your neighborhood, then it's hard for you to get out and actually be able to be physically active in that way. If you live in a neighborhood, if you don't drive and you live in a neighborhood where there's not a lot of options for groceries, so you may only have a convenience store in your neighborhood, you're not going to be able to consume fresh fruits and vegetables, no matter how hard or how much you want to. That's going to be very difficult for you to do. So, addressing those different things, so improving, built environment in the community that makes it more conducive to being physically active and getting out, or reducing what we call food deserts to improve food security. Both of those are very important. We all know how important it is to be able to eat well and exercise.
Sure.
So, but we have to take it one step back, one step further. It's not always easy for people to be able to do those things. And then if you're in a situation where you may not have a lot of disposable income at the end of the month, then going to the gym is not going to be an option for you either, right? So.
And I guess as doctors, we often think of kind of biomedical explanations for health, wellness, and disease. But it's also true to say that things like you said, the early childhood experiences, through their influence on the developing brain, can have impacts that lead to, say, mental health challenges or self-destructive behaviors, just as a way of adapting to the early life circumstance that people find themselves in. And what's often not said really is that does have long-term effects on biology. So leaving people much more open to the adverse effects of an external agent, like, for example, infection or a cancer, resistance, and this kind of thing.
Yeah, absolutely. We know that one of the most important things that influences our health really is our childhood experience, and adverse childhood experiences, ACEs we call them, they actually can have a great impact on outcomes, health outcomes later on in life. Think of what you learn in that environment, and your coping skills that you may learn in those situations, or not learn, and that can very much influence how you move and navigate through your life. But then there's also, people think about adverse childhood experiences as being very specific and definitive things, but poverty in and of itself can be an adverse childhood experience and can have great influences on how people, develop through their childhood years. So, it is very important to think about how we can improve those experiences to give children the best possible start that we can, because it's not it's not always easy to be a kid. It's not easy to be a parent either.
So if we were to think then a bit about the existing structures and processes that are in place to help support people through their social determinants of health, are there some examples that we could talk about from this province?
Yeah, so I think, certainly when we think about the social safety net that we have, so that there are options if people are not able to work for whatever reason that may be. There are options that are available so that people have an income, and that there are, we have to think about perhaps how we can ensure that that income is always in keeping with the cost of living, and how that people can be assured of having a basic income that can I think meet the basic needs that are there. So we do, we have these social systems in place that look at that. There are a large network of community services that are in place that help to support some equity deserving populations, to help reduce some of those barriers in our communities. And certainly there's lots of really good service groups that are out there that are really working very hard. If we think about Food First NL, for example, who really working hard to ensure that people have food security. Food banks are there for emergencies, and they've really become a fixture, really, I think, in food security in this province. But ideally, what we want is that we have very few people who need food banks, right? So Food First is really working and has some great innovative things that they're doing to look at that. There are other groups out there as well, and I'm afraid now if I start to talk about some that I'll miss.
We can't. It couldn't be comprehensive.
No, but so there are those institutional things that we have, in government. So our income support and drug cards that allow people to be able to get the medications that they need, even if their income may not be, they may not be able to afford them on their income. But and then we have a whole other net of services that are available through non-governmental groups and organizations that really help to support some of these social determinants of health and improve them.
Robert, I'll pause again and just say, are there some questions there that
we do? We actually got a few questions coming in now. So we'll take our first question here from Doug. How would you go upon measuring health inequities? What indicators would you use?
That's a great question. We're actually wrestling with this question right now. So in public health, we have to do a population health assessment. So every 5 years, our new legislation requires us to do a population health assessment every 5 years. And one of the things that we want to look at in that population health assessment now is really those upstream effects, and how do we what indicators do we use to be able to look at that. So I think there are, when it comes to measuring inequities, of course, what we have to do is really look at those indicators, but also then look at them in different areas of the province, between different groups in the province, different communities, to see if there are inequities. And that's really our job as medical officers of health. Our job is really to look at that data, to find those disparities, to find those inequities that may exist, and then to find out why they exist, and then to take that information to the tables that can do something about it. So, we are looking at what we would use to measure inequities, and really, looking at some of the indicators that may tell us more about the social determinants. So, there's food bank usage, but there's also things like food deserts. What's the density of grocery stores in certain areas? Are there areas that are less able to do that than others? We look at, the healthy food basket, and that sort of information can tell us, and the fact that it's, that it's so much cheaper to buy a healthy food here in St. John's than it would be in Northern Labrador, for example. So that's an inequity. So there are lots of things out there right now that enable us to be able to measure these inequities, and we're working on that at the moment, just really trying to find out what those, to define those indicators as well as we can. So that's going to be the work of the next few months, I think, for us in public health. So.
And it would be an important task for a learning health and social system too, to understand, where are the gaps and opportunities, and where do you need to put your effort to improve the equity of the system.
Right, exactly.
So we have another question from Tracy. The pandemic has been and continues to be rich in lessons. Looking back, what is an important lesson that we as a province need to keep to the forefront as it relates to the social determinants of health?
So I think certainly, I think in a lot of areas, certainly not just us that have experienced this, but the pandemic, I think, really laid bare a lot of those inequities that most of us who work in public health knew that they existed, but they really became apparent through the pandemic. So if we think about inequities with regard to income, and the pandemic made things, even post-pandemic, we saw that prices went up, and so those inequities became broader. We saw more people going to food banks. We saw more children availing of our school lunch program and our breakfast programs. So that certainly, that's, I think, something that it makes us realize that perhaps, there are lots of people who are getting by from week to week, but any little thing can, a sudden increase in prices can really put them into financial difficulty when it comes to even being able to put food on the table. Cleaning costs went through the roof, so all of these things, I think, really showed us that gap that can exist between higher socioeconomic percentiles and those that are in the lower.
And as you mentioned, I think there were some lessons learned when I was reading back about, say, the flu pandemic in the 1918 period, and the differential impact it had on some Indigenous communities of the province at the time. That may have, and I'm only putting words in your mouth, but may have influenced the choice to offer vaccines earlier to those populations. Would that be the case?
Yeah, I think we all, and even through this COVID pandemic, we saw that that people who had Indigenous heritage were disproportionately affected by COVID, both with infection rates and with severity of disease. And the reasons for that, I'm sure, are varied. And so, when the vaccines were rolled out, it was done, very much with risk in mind and who was at highest risk. And that is why part of the reason that those decisions were made in that way. Again, this is about equity. It's trying to improve health outcomes for those, who may have the greatest risk. So.
And I saw some data today. It was shared with us by a visitor from the Institutes for Health Research who fund our program. And he was showing that if you look back over the recent decades, global poverty rates were going down fairly steadily. But then with the emergence of the pandemic everywhere, more resources were put into managing that. And of course, global poverty has come back up. So there will be a big interaction, I think, between social determinants and stresses like the pandemic.
Oh, yeah. Absolutely, yeah. It's really, if you think about it, even in your own little microcosm, when you get by and then something happens and all of a sudden it's it's not so good anymore, and you have to you fall behind on things, and you're not able to do all those things that you used to be able to do. You've got to make sacrifices, and
Yeah.
and I think that's being felt everywhere in the world right now. And you're right, yeah, there was a lot of redeployment of not just people but money as well to certain areas. And so it's when you get caught up and it was all consuming for so long that it's you can see how other areas will lose attention and focus.
Yeah. Which I guess is why we need to kind of consider the future rather than the past now as well.
100%. Yeah, yeah. And any pandemic that we're planning for now, we have to think about. We have to think about social determinants of health. We have to think about unintended consequences of any kind of action that we take, and try to reduce those, and to anticipate them, and put things in place to prevent them.
Yeah. I mean, even the social isolation, this became a topic that was researched by some of our patient partners, because our research is what we call patient oriented. So we have people working with us not as subjects of the research, but as researchers who help us. And they were interested in that topic of the impact of social isolation during the lockdowns, and it's substantial.
Yeah.
And I know you were always faced with having to balance the challenge of control of the virus versus the health of the population.
Yeah, and it was, yeah. And in the beginning, we knew very little, and we didn't know what would happen, and so you err on the or not err, but you work on the side of trying to prevent as much infection as you can. But now we've learned so much over the last 2 to 3 years that I think now we're at a point where we work from the other side, and that we realize that social isolation just really can't continue, and I think will certainly influence, especially when it comes to older people. I think that group probably more than a lot saw the impacts in this province that social isolation would have. So I think it's definitely going to influence how we approach things in the future.
Right. Good example of learning as you go. Any other questions, Robert?
Yeah, they're coming in pretty hot and heavy here now, Brendan. So I'm going to continue on with this. We got a question from Rebecca. We have heard that income can have a huge impact on health. However, we have seen the cost of living rise significantly over the last year, which impacts people's abilities to choose healthy foods and heat their homes and other things such as like that. So what kinds of solutions are being thought about when it comes to those barriers?
Well, certainly, there's lots of conversations happening right now, all across the country, I guess, about basic income and what constitutes basic income, and these are conversations that are really important for us to be having. Government is certainly right now in the process of developing a social and economic well-being plan, and that is looking at many of these questions, and trying to figure the best way forward with regard to social and economic well-being. So there is lots of work being done and continuing to be done, but conversations really are just starting, and I think I'm very encouraged by the amount of emphasis that's been placed on social determinants of health now.
I'll take another one. This one's from Colleen. The current Health Promotion and Protection Act has one of its purposes is to promote health equity within the population by addressing the social determinants of health. A health in all policies approach is one of the ways we can achieve this and is included in the Act. Can you give an example of how the health in all policies approach, is it being applied to our province, or how could it be?
Yeah, that's a great question. Health in all policies is actually one of the ways that we will address the social determinants of health. And so what we mean by health in all policies, for anyone who might not know, is that health is really when any department in government, or it doesn't just have to be the provincial government, it could be municipal governments, it could be in school systems or any entity like that, that they think when they're making policies that they have to think about the health of the population in and how it will be impacted by that policy. So it's not just that the policy doesn't negatively impact health, but how will it actually positively impact health? And so our goal with health in all policies is to really try to make every policy that comes in have a positive impact on health and wellness outcomes. And you know, this act, the new act that came into being, that came into effect just before the pandemic started. And so a lot of this work was supposed to have happened over the last couple of years, but unfortunately has ended up having to wait out the pandemic like so much else. But all of those frameworks and things are in the process of being developed at the moment. But, you know, so what we would love to see with health in our policies is that there's you know, a way that people can, people within government, people who are making policies will have to consider health in all of those policies and how to improve health. And that, you know, we'll be able to expand that beyond the provincial government, that municipal governments will also see the benefit in doing that, and hopefully, you know, improve some of those social determinants. So if you're thinking about a new development in an area, whether it's a, you know, a resource development, or thinking about a new industrial development, that you would not just think about the environment, that you would actually think about, okay, well, how will this impact the health? And not just what will people be breathing in, what will people, you know, but think about wellness in general. Will this improve health outcomes? Will there be any adverse events that may happen as a result of this development that could impact health? Will we see, you know, boom and bust economy with this? That has a definite effect on health and mental health for sure. You know, will this have an influence on zoonotic diseases, which are diseases that we get from animals? Will there, you know, bring humans and animals into, you know, that interface closer together so that we see, you know, jumps from the pandemic, for example. So those are questions that you would ask when you're thinking about health in all policies. So we're very excited to be working in that, and I think it's foundational really to us being able to address the social determinants.
Brendan, perhaps we'll take one more question before we continue on. So this question goes, our province is undoubtedly in a very unique scenario geographically, with the majority of our population based in a handful of city centers and the remainder spread out in very rural small towns. What are some of the Newfoundland and Labrador specific issues that may negatively impact our social determinants of health, and give examples of climates and perhaps population densities?
Yeah, so, you know, it's true. When you have remote areas, it does make lots of things more difficult, right? If we think about it in terms of being able to get basic necessities of life, even like food, for example. So food security, it's not just about being able to afford food, but it's actually about food being available where you are. So if you live remotely and you know, it's difficult for you know, the weather is interfering with food being able to get there, that certainly has an impact. But we need to think about that in terms of ourselves here in this province. Really, in general, 95% of our food is imported from elsewhere. So, you know, in a few days of no ferries, and we all see what happens at the grocery store. But in other ways, you know, access to healthcare we know is a determinant of health, and the more rural and I guess dispersed that the population is, that sometimes that makes that more difficult. I think that, you know, there's some very exciting things coming with regard to community teams and things like that. So I'm hoping that we'll be able to address some of those issues in the future. And just being, being able to access services in general may be impaired if we more dispersed population. And then if we look at it the other way, then you have other areas where there's high population densities, and so then housing becomes an issue, trying to find adequate housing. And so that can certainly impact the social determinants of health as well. And if we think about climate change, I mean, that's going to have such an impact in the future, and not so distant future, really. We're already seeing the impact that that's having in some of our coastal communities, and in the north with sea ice being lost. And I think, there's going to be the impacts, I think, from climate change on our mental health and well-being I think it's going to be far greater than any of the other impacts, and they are going to be great as well. But so
I guess tied to rurality and remoteness here is also the aging population issue, and we've lost a lot of say the support from younger families who could help their elders in these communities, who were probably much more self-sustaining communities in the past, and they were reliant on an industry that they could access locally, like the fishery.
Right.
But that's become much more challenging now.
Yeah, and certainly, it's something we see everywhere. Really, is that I think about the area of the province that my family is from, and that many of my relatives still live in, and you're right that it is a challenge, ongoing challenge, and it's certainly, we know that with aging comes a different set of health issues, and it's also about trying to make those communities as age friendly as possible, and sometimes that can be quite difficult. And
and some of the approaches that have been taken, I guess, in recent decades, like moving people into nursing homes, would not necessarily be the most supportive of their health. I know there are models in other countries where they've moved a lot more to congregate living, multi-generational living, so you don't have the isolation of older people alone. They're with younger people in their family or otherwise.
Yeah, and there is that move towards, a more diverse community in that regard. Yeah, and certainly we're trying to see people age in place now as much as possible. And having worked in long-term care for many years, I can certainly, see the value in supporting people aging in their communities, and because that's where they're happiest, and that's where their mental health is best. It's where they're the most stimulated, and that's really important in preventing dementia.
Sure.
Yeah, in particular.
We'll take another question then. This is from Tony. As we move toward the start of the new provincial health authority in April, how do we ensure the new organizational structure encompasses the social determinants of health?
That's a really good question, and all these conversations are happening now. But in public health, we've been involved in conversations that when it comes to the provincial health authority and how we want public health to look. So right now, of course, there's public health at the provincial level, which is where I am, but there's also public health in all the regional health authorities, and there's medical officers of health as well that are in those health authorities, in addition to many other people besides public health nurses. There's health promotion specialists, there's environmental health specialists, so we've all had conversations about how public health and health promotion really should look in the new provincial health authority, and I think we feel that we've come up with a good model that's going to help see us forward. And there's all of that is going to sit in one area of the provincial health authority, and I think those connections are going to be really important for, our connections at the provincial level with the provincial health authority, as well as the connections that the health authorities have in their communities are going to be really important going forward. So we're also developing a framework for public health in the province, and that's going to have our our core programs established, as well as our standards and policies around that. So that's all going to influence how public health in particular will be working in health promotion and influencing social determinants.
And I also understand from the draft structure that I've seen that there is an explicit recognition of the need to move to a learning health system. And of course, inherent in health accord was the linking them with the social care. And yep. You mentioned the wellness policy. I think that's being developed as well. That would seem to me to integrate the actions within different government departments.
Yeah, so it's certainly the structure that's been proposed, and I'm not sure how much I can say about it, but certainly the structure that's been proposed is it's quite exciting, really, to think about it, that wellness would be its own entity within government that would cross-cut different departments and would be connected then with the provincial health authority and those regional areas that are looking at the wellness groups that are in the zone. So I think there's going to be lots of potential connections, and I think it's a really good way forward. And if we think about other places where this has worked, these types of models have worked, Australia, New Zealand in particular, I think it's really exciting for what the future may hold when it comes to social determinants.
It kind of takes me to a question I had planned to ask you anyway, but it's coming up naturally. Can you say anything yet about mechanisms that are being planned to allow integration of the inputs from, say, community organizations, municipal government, provincial departments, the health authority, in focusing in on the wellness and health of the population?
Yeah, so there's certainly lots of conversations happening about how wellness, how we will approach wellness in the not only at the government level, but then down through the provincial health authority and then into the other departments. So if we have a wellness entity within government, then that group will span those departments, and so it'll. I think we'll see that there'll be more collaboration, fewer silos. That's been something we've heard again and again. That there's too many silos, and this group is doing something, this group is doing something, and they're very similar things, and they don't know about each other. So we're hopeful that those lines of communication will be able to be opened. And I think the health and our policies framework, once we get that established, will really be helpful to look at or to help guide policies so that we are considering health. And there are processes in place now where we would see in health, we would see things that are being done in other departments, and there are well-established protocols that happen. So we are involved, or at least offer input lots of times, but our goal really would be to be involved from the beginning, and then to have actually people to consider that, people in other departments to consider those types of questions about health and how will this affect health right from the start. Really, that's our ultimate goal. So I think we'll certainly see more of those processes or more of those connections in the very near future.
Okay, great. Robert, anything else?
Yeah, sure. So we got a question from Chris. Given that access to primary care is difficult right now all throughout the province, what is the benefit of focusing on the social determinants of health at the same time as we work to address the issues of access to primary care?
Yeah, so they're not I think, we have to really focus on both at the same time. They're both, right now, I mean, primary care is in a critical juncture, I think, to be able to think about how we deliver primary care. And so that has to be addressed. There's no doubt about that. Addressing social determinants of health, as I said previously, is often the inputs that we put into the system. We don't see the benefits of that for quite some time. So addressing the social determinants of health at the moment may not influence exactly what will happen with, may not influence the primary health care situation right at the moment. But down the road, we would hope that we will have a healthier population and therefore, less of a demand on on primary health care won't be the same. Primary health care is always going to be necessary, of course, but that the demand won't be quite the same. But it's important. It is really important to focus on both at the moment, for sure.
And I guess they're intersecting too, in the sense that it may be hard to recruit professionals to communities that are not optimally functioning. So if we can
absolutely
make the work better, maybe that will help.
Yeah, absolutely. And I really love this team model that's being proposed. I think, having worked in primary care for many years, I'm really on board with that.
Okay.
So I got a question here from Paul. These social determinants vary in terms of the levels of control individuals can assert. Are you aware of any research that has been done to rank what educational tactics work best to encourage people to change behaviors and make better choices when they do have that level of control?
Oh, that's a great question. And I don't know if I mean, there's lots of research that's out there that talks about, how motivation works and how, people's activity, how people can develop habits and things like that. And so there's lots of research that gets into that, and unfortunately it does get a little bit out of my scope, looking at that individual, how do you change that individual behavior. But first and foremost, I think we have to make an environment that allows those behaviors to be easier and easy and accessible for everybody. But yeah, there's lots out there, I think, that we'll talk about how to improve activity levels, for example, or how do you encourage people to eat more fruits and vegetables. But yeah, getting a little bit out of my scope.
Yeah, well, as people ask questions, we don't necessarily have to answer them tonight, because this is an ongoing series, and we're happy to get topics or ideas that
absolutely.
we could explore more fully, bringing other people to the table as well. That might be one example of something like that.
Yeah.
Sure. So I got another question here. The health and social care is traditionally funded separately. To improve social determinants of health, we need significant investments in social care. What are your views on how the government may manage the needed investment in social care whilst also dealing with the healthcare issues?
Yeah, so we know that that the social, I guess, some of these social care areas, like income and housing and things like that, certainly those are important social determinants of health that we need to, we need to look at them. We need to address any issues that have come up with them, and we need to continually address that, obviously, to ensure that people are able to have the best chance to have a healthy life. With regard to what's happening, there are conversations that are happening way outside of what I would be necessarily a part of, and especially because a lot of this is happening in another department. But So I certainly don't want to speak out of turn and say something that's not correct there, but yeah, we can't consider any of the social determinants of health without really looking at that social care as well.
It's a challenge, I think, for the way our political systems operate, in a sense that you have people elected for short terms, and they will be under pressure to deal with the immediate concerns, so the things that come up, like mentioned, access to primary care, whereas being able to make an investment for a longer term benefit may not bring a political reward to that person. So really, I think it comes down in part to advocacy from the population to influence the decision makers to understand the importance of these longer term investments for the well-being of the population in the future.
Yeah, and it is, that is one of the ways that we as a society and as members of a society can influence what happens is to talk about these things with your elected officials, and to have them understand the importance that you place on it. There's no doubt about that. It is, our system is set up in such a way, and I think we have, within the public service, there are some very dedicated people who are working very hard and have been for many years at trying to advance a lot of this work, and that will continue. I think, there is a great opportunity with our new Public Health Protection and Promotion Act, that, we have somebody who is that position of CMOH will always be there to be a person who is monitoring health of the population, looking for disparities, looking for, any inequities that may be there, and to bring that to the attention of the people that need to see it. So, we do have some mechanisms in place where we would be able to continue to look at that, but yeah, it's not unique to here either.
No, not by no means, but it does require active input.
Yeah,
I think,
absolutely, yeah.
So, Brendan, I'm being very mindful of the time, but I do have an interesting question that is actually perhaps addressed best for you to answer. Mike is asking, what is the role of MUN in learning health systems and applying the social determinants of health beyond the training of healthcare professionals?
Yeah, that's a good point. So we would obviously have a role in training health professionals. But today we had a conversation with people from, it turned out they were Eastern Health, but we're thinking provincially about what role do academic units play in a learning health system. And clearly we bring certain skills to the table in terms of posing questions that can be answered, working with data, doing analytics, presenting interpretations, knowledge mobilization, aiming to influence or guide decisions, if you like, with evidence. So that would all be part of what our group, for example, in quality of care would do in part, but it goes beyond us. So there's many components within the university that would have a role. People might be familiar, for example, with the work of the Harris Center, people in the Department of Geography. You might learn geography in school about where rivers are and that, but it goes way beyond that. And it does look very much at the distribution of issues.
Mm-hmm.
The community accounts, for example, which are reflections of economic well-being in different communities in the province, exist and can be used to understand patterns of equity and this kind of thing. So the university would have roles in generating that information and using it to help people make decisions.
We would love to have a great partnership with the university when it comes to this type of work, looking at social determinants.
Yeah.
So I'm going to try to merge some questions here for you, Dr. Fitzgerald. What will be some of the strategies for improving health equity in those who are perhaps discriminated against?
Yeah, so, it's really about recognizing where these disparities or inequities exist. It's about and then about bringing them where they need to go to be able to address them, right? So you have to first identify them, find out why, and then bring them to where they need to go to be addressed. And we can't do that at all without engaging with those populations to start with. And so talking to people who have lived or living experience is a really important strategy, I think, that we have to embrace as we move forward with this work. Co-design is sort of the term that we use now to talk about, designing programs with the input of people who are going to be using those programs, and ensuring that we have taken into account those experiences and feedback that could really make a difference for the success of a program or the impact that a program may have. Because if we think about inequities as a coin, and many of us who are working in public health and in other areas, we're kind of on top of that coin. We don't even know that coin exists. But if you're underneath that and affected by that, then you can't help but see it every time you look up. And so your experience with the effect of that inequity, whatever it may be, is certainly, that expertise is not something that most of us who are working in these areas would know. And so it's really important for us to have that input and that collaboration. So that's a very important strategy to be able to address some of these social determinants.
And it is a key component really of a learning system. So we would talk a lot about engagement of people, and in a social system it might be engagement of communities rather than an individual.
Absolutely.
So patient-centered care is a term in medicine or healthcare, where you try to imagine what it's like for the person having the journey through and help them co-design it. So we would look to do that in a learning health system. But in a learning social system, it might be as much as working with an Indigenous community or homeless people to, as you say, co-design processes and options for them to try and improve their equity in health.
Yes, and understanding that they are the experts in that experience, right?
Exactly.
And to appreciate that expertise.
Sure. So we got a great question from Josephine, and it's something that I've only learned of as of recent. And she asks, some countries are using social prescribing in healthcare. Is there a chance we will get social prescribing here in Newfoundland and Labrador?
So I know that those conversations are happening, and it's definitely something that's been looked at. The degree to which that's been looked at the moment, I can't really comment on, but it is definitely a part of the conversation, and something that I think is really piquing the interest of a lot of people in the fields of health promotion, especially. So
I think it'll be a natural fit, with some of these community teams that you talk about, where there would be a diversity of health professional backgrounds, and where some people in their education would have a greater feel for the need for social prescription.
yeah,
And by social prescription, we mean not giving a medicine, but rather giving something that helps a person adjust their lifestyle. So I've heard of things like park passes. So somebody wants to get out and be in nature and something, and yet they don't have the money to do it. So you're able to give them free access to that kind of resource,
yeah,
or something similar to that.
Yeah.
So perhaps we'll, I'm mindful of the time here, Dr. Barrett and Dr. Fitzgerald, so I'll ask one more question perhaps before cluing up here. So this is a question from Tina. How would positive parenting programs fit into the health determinants?
Yeah. So certainly parenting support, I think, is critical. Is a critical health promotion tool, I guess, that we have, and there are many parenting support programs that are out there. There are, there's all kinds of formulas that have been tried in lots of places, and I think part of it is really recognizing when when there may be a family who could use support, where, there may be that having an intervention in the sense of it could be any number of things. It could be supporting to improve food security, for example. It could be supporting to improve or to strengthen parenting and parenting techniques, or any number of things that can support parents to be able to create safe and supportive environments for their children. We talked earlier about adverse childhood experiences and how that can have such an impact on health and wellness outcomes later in life. So really putting those programs in place when needed to be able to change some of those, potentially change some of those experiences is really, I think, something that will have a big impact. And we've seen that in many places in the world where, they've put in very almost ingenious in their simplicity, really, these programs that can really help support the parents and really give the kids the best start possible, from peer supporters to all the way up to having professionals going and providing help when needed.
I think we probably have to think before people become parents as well. So absolutely. If they're under a lot of degrees of stress because of their prior backgrounds, there can be intergenerational effects. So if you've come up through a poor background yourself, you've had a poor childhood. When I say poor now, I don't mean in a resource sense, but just trauma experiences. It can be hard then to become a very nurturing parent yourself.
That's right. Yeah, and parenting support programs are really can really make a difference, and have made a difference. I mean, we see family resource centers here are a really really great resource that have provided such support for so many people, and so those are great examples of how these types of supports can really make a difference.
So that concludes the time we have for tonight's session. I want to thank Dr. Barrett and Dr. Fitzgerald for leading us through a really great discussion on the social determinants of health, especially within Newfoundland Labrador lens. And a big thank you to everyone who joined us online this evening and listening and participating in our discussion. Just a reminder that this recording of the session will be on YouTube, Quality Care's YouTube channel in the coming days. Our next session will take place on February 28th at 12:30 p.m. Newfoundland time. We'll be joined by Josh Smee, who is the CEO of Food First NL, for a discussion on food insecurity. Lastly, you'll see a very short post-event survey on your screen after we end the webinar. We'd appreciate you providing us any feedback or ideas for future healthy discussion. Thanks again, everyone, and have a great evening.